Dr. Service, thank you very much for your time today. One
It's
last
been my
question.
pleasure.
How do you approach educating medical students, and what core psychiatric skills do you feel every physician should possess?
Well, I'm a big believer that medical students need usually more psychiatric training than most medical schools provide. And that's because I think for anyone going into primary care, you're going to see a large percentage of patients whose primary issue is a psychiatric issue. That's probably less true in non-primary care specialties, but once again, I think the skills, diagnostic skills and therapeutic skills that you can pick up from training in medical school and psychiatry could be quite useful. At the very least, psychiatry is going to hopefully teach you to be able to conduct an empathic interview with a patient, to be able to look beyond the surface in terms of understanding their behavior, to be able to help them, any patient, around health behaviors, adherence to medical recommendations. These are things that psychiatrists should have and do, I believe, have the expertise, the best expertise in medicine for addressing these things. And these are core skills for any physician. They're not, in any sense, unique to psychiatry. And it's those things that I think we try to emphasize with medical students, rather than trying to teach medical students a whole lot of psychopharmacology or a whole lot of psychotherapy. Obviously, as I said, primary care physicians do need to learn something about those treatments because they will, in fact, be providing them, particularly psychopharmacology. And so it's important for medical students to have some training and exposure to those. But again, I think focusing on effective doctor-patient relationship, effective empathic interviewing, helping patients make health behavior changes, these are the kinds of things that should be part of a psychiatry curriculum for medical students, that are skills that every physician needs to have independent of specialty. For, as I said, primary care physicians, I think you can make a very convincing case that having a fundamental knowledge about psychopharmacology and knowing something about supportive psychotherapy and cognitive behavior therapy are going to be something that you will put to good use. And so I think those are also important or helpful elements of a psychiatry curriculum in medical school. The last piece that I think is really important for medical students to get from psychiatry in medical school is what I would call stigma busting. That mental illness is something that most of us growing up, there's a stigma associated with it, and oftentimes it's not until you've had exposure to psychiatric patients and good teaching and supervision in psychiatry that you begin to see mental illness in a new light, and you understand that you're not going to talk a patient out of psychosis, or that it's not all just in their head. But when medical students start out, most of them, I think, have not had experiences to help them understand that. And one of the things that happens in medical school is that you gain that understanding and appreciation of mental illness, and it decreases a lot of the stigma that you might have around it.
Great. Well, thank you very much again. We really appreciate your time.
It's been my pleasure. Thank you.